Hi everybody, I'm Dr. Heidi Cook and this is the Dr. Heidi Cook Show. First of all, I want to apologize for my voice. I actually feel a whole lot better than I sound, but whatever I have going on has kind of settled right into my vocal cords, so I apologize. One of my daughters very lovingly told me I sound like a dinosaur, so hopefully it's better than that. So on today's show, I want to do a couple of things. I'm often referring to the spa at West Glen, which is a medical and day spa where I'm the medical director. And because I'm often referring to that, I want to give you a look inside the spa. We opened our doors in December of 2005, and then we expanded in 2012 to the 5,000-foot location that we are today. Along the way, we've added a lot of different services. We've added new people, such as our dietitian, and have really tried to grow and keep current. So I wanted to give you a look inside, show you what the spa looks like and the things that we do there. We also have a guest today. She is an employee of the spa who is our permanent makeup specialist. So she will come on, we'll talk a little bit about permanent makeup, how it can make your life a little easier. And then the last thing that I would like to do is highlight one of the products that we have at the spa. It is a product that can also be very convenient, make life easier, but it also has a nice effect on some of the outward appearance of aging. So when we come back, we'll take a look at the spa, talk to our guest, and look at one of the products. Well, welcome back. Today we have a guest who is one of our employees at the spa at West Glen, and this is Terry Wilson. She has been a licensed esthetician for 13 years and has been a permanent makeup specialist for 10 years. And we are so thankful to have her at the spa and all of her services. So thank you for coming today too, Terry.
Thank you for having me.
Yeah. So why don't we just start in general? We're going to be talking about permanent makeup. So what is permanent makeup?
Permanent makeup is a cosmetic technique that employs tattooing into the eyebrows, eyeliner, lips, scar camouflaging.
So it's basically a tattoo.
Yes.
Okay.
Mm-hmm.
So and is it safe to be tattooing on the face?
Yes, it's very safe. They use an iron oxide product in it that's used in most all of our cosmetics today.
Okay, and it's been around for a long time, I understand.
Yeah.
Okay.
They've been doing permanent makeup, I would say, for 30 years or better.
Okay. And so what about your instruments?
I have a medical grade. It's called like a little tattoo pigment gun.
Okay.
And what with my machine, it has that I can regulate it for eyebrows, eyeliner, lips, and medical if I'm doing scar camouflaging or nipple areola or anything along that.
Okay.
And it groups in needles. They're all pre-packaged, sterilized, and I might use a group of little 3 needles or 5.
Okay. Okay, but they're individual, so they're one-time use.
One-time
disposable.
use, disposable. I throw them away in a Sharps container, and they're all always opened a new package one each time that I do a procedure.
Okay. And so you do eyeliner, eyebrows, lips. Are those the main areas?
They're the main ones
Okay.
I do. I would say eyebrows and eyeliner are the most that I do.
Most popular.
Mm-hmm.
Okay.
I do some scar camouflaging and nipple areola also.
Okay. So if someone was interested, they would come in and have a consult with you. And what do you cover in the consult?
Well, I usually go over medical things if they're diabetic or they're on any blood thinners, and kind of get an idea of what they're wanting. And we kind of talk about on the brows and how they want them done. Like some clients might not have any hair because they've over tweezed through the years. Mm-hmm. So they're wanting me to help them kind of design a brow.
So do they get to help pick color and shape and that sort of thing?
I always let them help pick the color and shape because everybody's a little different. I mean, somebody might like a thinner brow, somebody like a thicker brow.
And color selection, is there a wide range of colors or just a few?
Well, in my doing the eyebrows, there's a lot of selection.
Okay.
Eyeliner is a little more limited. I do have some colors like a teal or a plum, but most generally, the clients use a black.
Okay. So how long of a procedure is it once you start?
It's usually, once I start, probably about an hour. It just depends on the client and how they numb up. Everybody's a little different. Some people have a high pain tolerance, some have a lesser pain tolerance. Okay. What I do is when I bring them in, I'll numb them up with a topical cream for about 20 to 25 minutes. And then I'll go back in using the same procedure that I'm going to use to tattoo. And I'll open up the skin, kind of break that skin open so that I can put another numbing cream that's a quicker acting down in, so it gets a little further down into that dermis layer of the skin. And then throughout the whole procedure, I'm always adding more just to keep them comfortable. If they need a little break, sometimes we'll stop.
Okay. I was going to ask, because in general, tattoos are known not to be very comfortable. So I have had the eyeliner before, and I can tell you that I was comfortable. The topical numbing cream works very well, and as far as discomfort, there wasn't much. What I do remember is obviously the pen is vibrating.
Yes.
And it's more the vibration that's a little funny feeling than the actual pain from it.
Yeah, most of my clients will say they feel a little fluttery, tickling feeling, especially on the eyelid itself. The eyebrow's not quite as, sensitive.
Much, yeah. So once someone has their tattoo put on, what are your instructions to them when they go home to kind of post-procedure?
Okay, when they go home, I'm going to tell them it's going to look darker, brighter, and sharper, especially brows. Clients, I don't care what color we use, it can be the lightest color. It's going to look darker, brighter, and sharper. And it's kind of a shock to them right afterwards. But within 5 to 7 days, it'll develop a crusting in a couple of days. And once that crusting comes off, usually within 5 to 7 days, it will get lighter and the skin kind of softens up. They will also be applying a Vaseline 3 to 4 times a day just to keep the area moist, and I don't want them picking at it at all.
And how long can they not wear makeup?
Usually about 48 to 72 hours.
Okay. And when people want to come in, are there anybody who really should not have permanent makeup done?
I would just say probably your diabetic clients that are, they don't heal quite as well. Usually I'll have them go and get a note from their doctor saying that it would be okay. But most generally, there's not too many people that can't do it unless they're just very sensitive and can't tolerate the procedure itself.
And instructions as far as when people come in for that week before, do you usually tell them not to take ibuprofen, aspirin, those sorts of products also?
Anything that's going to thin the blood,
Okay.
we stop all of those. And if they're on a blood thinner, they're going to have to be off that blood thinner at least for 6 months before they can have the procedure done.
Okay, and how long does it last?
It can last 2 to 5 years. A lot of clients like to come in a couple years and get a refresher on it, just to kind of pop the color back out.
Touched up.
Okay. And at that time, the cost is less effective than it was when they initially came in.
Okay. You mentioned in your beginning scar camouflage. So what all is that? What do you do?
Scar camouflage is usually when a client will come in and they're concerned they might have some hypopigmentation, they might have a fine scar that's a lot lighter than their own natural skin tones. Birthmarks is another one. Usually they'll come in, we'll pick a flesh-colored pigment that matches their skin tone as close as we can, and then we tattoo from there.
And I think one of the probably more rewarding parts of what you do is post mastectomy and the areola tattooing. Has that been a pretty big thing for you?
I have in the past done a lot of them. I think when I worked for a doctor that worked with a lot of breast clients, I did a lot of them. But it is really fulfilling to be able to just finish out that breast once they've reconstructed it.
And I think maybe that's some things that clients don't even know about.
Right.
So getting the word out there about that, I think, is always a good thing.
Yes.
So now it's very convenient. I know it was so nice to just roll out of bed and look awake having your eyeliner on. But who else would benefit from having permanent makeup?
The people that have like vision problems, there'll be alopecia patients, clients that are very active, allergies.
Okay, yeah, I've had some people who just worked out a lot and constantly had eyeliner dripping down, so they did that. It's also a very good procedure, I think, for anybody who has any motor inabilities, whether it's Parkinson's, tremors, something like that,
Yeah,
where they just have a
absolutely.
difficult time putting it on. So,
Absolutely.
okay. So Terry Wilson, she is at the spa at West Glen. If you're interested, give her a call, or you can call us and we can send you one of her brochures, get that information out to you. If permanent makeup is just a wonderful, convenient thing, so if that sounds like of interest, give us a call, 225-2642. And thank you very much for joining us.
Thank you for having me on, Heidi.
So today I wanted to highlight one of the products that we have at the spa at West Glen, and it is Latisse. You may have heard about it before. It is a product that basically grows eyelashes longer and thicker. It was FDA approved and available to everyone starting in December of 2008. Latisse, the medication in Latisse is very similar to a glaucoma eye drop, and that's actually how they figured out how it would work. These glaucoma patients would come back to the doctor after using these drops and would have these long, lush lashes. So they started looking into how they could use a similar medication, not as an eye drop, but as a topical, and have the length and the fullness come in without affecting the pressure of the eye. And that's what they have done, and the final product is Latisse. So Latisse, how it works is that, and this is great for a physician, if you have a working eyelash or a working hair follicle, Latisse will work on that patient. What it does, every hair follicle on your body grows in phases. So you have a portion of hair follicles that are in the growth phase, and then you have a portion that are in the rest phase. And that's every hair on your body. And so what Latisse does is it will put a higher number of hair follicles into that growth phase and keep them there for a longer amount of time. Therefore, you get the growth and the thickness. So age or genetics of eyelashes definitely plays a part in how long, how full your eyelashes will be. So you can take a look at mom and dad, and that will at least affect a little bit of how your lashes will look. But what they have also determined through studies is that as you age, your lashes become less long, less thick, and a lighter color. So all of these things can happen, and they start occurring at least in the 30s and sometimes even by late 20s. So as you age, you have shorter, less full, and lighter color lashes. So that's a perfect time to start using Latisse. How you apply it, it comes in a dropper, and then you have your brushes. So how you apply it is just once a day, a thin layer to the top lash line, and you only need to put it on the upper eyelid. You don't need to saturate it, just a light covering will do. You do that once a day, and that's it. What you will notice is typically between 4 and 6 weeks, you'll notice that there's a change in your lashes. You want to continue using it every day for up to 16 weeks. And at 16 weeks will be your maximum effect. What they noted through the studies is that 16 weeks, the lashes were 25% longer, 106% thicker, and 18% darker. So really a remarkable difference in 16 weeks. At 16 weeks, you want to talk to your doctor or whoever prescribed it to see how you should proceed from there. Basically, what I tell people is you can use it a little less often after that 16-week period. You can usually get by with about 3 times a week and maintain those long lashes. The people who should not use Latisse is if you have any sort of eye problems, any problems with pressure of your eye, any infections, that sort of thing. Also, pregnant and nursing women, it was not studied on pregnant and nursing women, so I would just not use it during those times. Side effects, you can have some red and itchiness that occurred in 4% of people. If you continue to use it, those typically will go away. Also, some people experienced a little bit of darkening of the skin right where they placed Latisse. That is temporary. It goes away when you stop using it. But that, in most cases, did not even bother people because it was in the lash line. So if you're looking for longer, darker lashes where you don't have to use mascara, can just roll out of bed, it's a perfect thing for you. If you have aging lashes, it's a great thing for you also. So if you're interested in Latisse, give us a call. I'm often referring to the spa at West Glen, so I would like to take you on a little video tour of what the inside of the spa looks like. We'll take a look around and we'll see some of the things that we do there, some of the people who work for us, and we would love to see you in person. So if you ever have a chance to come to West Des Moines, Iowa, please stop by and see us or give us a call, and we can help you with any service you may like. I'm Dr. Heidi Cook, and this is the spa at West Glen. The room that we're in right now is the medical room where we do our medical treatments. What we do here is a variety of things. We do Botox and we do fillers. Botox is one of the procedures that we use to take care of wrinkles. So the main areas where we use Botox is for the angry lines between the eyebrows, those horizontal forehead lines, and the crow's feet. It's one of those procedures that is done very quickly in about 10 minutes and they're out the door. The others are fillers that we use for a variety of reasons. Our newest filler is for cheek augmentation, which is basically giving someone back their youthful cheek. That causes the volume to lift, which also helps around the mouth. We also can use Juvederm, which is another filler. We often use that here in the nasolabial folds, and we also plump lips with that. All of the medical treatments are done within about a half an hour, and people can go back to work or go back to their daily life. Our newest injectable is Kybella, which we use underneath the chin, which is FDA approved for dissolving the submental fat or your double chin. We're at the front desk and we're with one of our concierges. This is Anne Marie, and she is ready to help you with anything that you need, whether it's to take your phone call, to purchase a gift card, or to help you schedule a massage, a mani, a pedi, or a facial. Here at the spa at West Glen, we have a dietitian on staff. We have a weight loss program, and it's called Ideal Protein. It has originated in France over 25 years ago, and it was a physician who first came up with the whole method. He came up with it because the French Olympic athletes were wanting to lose weight in their off-season without losing muscle. So behind me is all of the food that goes with the Ideal Protein weight loss method, and our dietitian Jess takes you through 4 different phases, which will take you from the beginning all the way through maintenance, so the rest of your life can be online and with healthy eating. This is our in-body scale that we use with our weight loss program and other nutritional patients. What you do is you stand on it with bare feet, hold on to the handles, and through a 5-point impedance system, it will give us a lot of information. Everything from total body weight, BMI, your fat percentage, but it will also tell us where your water is, intracellular, extracellular, and it will tell us how much weight is in your legs versus your arms versus your torso. Over time, we can graph things out and see the improvement, and it will also give us endpoint goals as far as what your ideal weight is and how much you need to lose to get there. We are standing in one of my favorite rooms in the spa. This is the relaxation room. One of my goals for every client who walks in the door is to take them out of West Des Moines and into a different place and help them escape. So what we do is when they arrive for their treatment, we put them in a robe, offer them a beverage such as hot tea, wine, coffee, and have them relax and kind of de-stress here before their procedure.